Welcome to today's webinar, designed for RHCs and FQHCs as they consider standing up chronic care management programs during COVID-19. My name is John Michael Carter. I'm the CEO of ChartSpan, and I'm delighted to welcome Annie McCoy, ChartSpan's Chief Growth Officer. Annie, welcome.
I'm happy to be here. Thank you.
You have such an interesting background that started in healthcare as a nurse. Walk us through that.
Yeah, I'll do so. I'll give you the abbreviated version. Several decades ago, I did begin as a nurse. My clinical area is critical care. I went on to manage critical care services, have my master's in health administration from Georgetown University in Washington, D.C., had an opportunity to learn about outcomes and care and case management in our first foray into managed care in the 90s, and have had an opportunity to work in the tech space in a consulting role, and I was with the advisory board for nearly 20 years based out of Washington, D.C., where I worked exclusively with large national footprint health systems and helping them advance and gain benefit out of business intelligence tools. It's been a passion of mine to drive data into performance improvement and to make a real difference in the way we're able to care for patients, which is exactly what I think we do at ChartSpan every day.
Of course, one of the things that we spend a lot of time thinking about, Annie, is the value-based care delivery model. Explain the role that we play there.
Sure. So John Michael, every conversation I have, whether it's within our company or with our clients or those evaluating our services, is to sort of level set around the problem. And I think the problem in traditional terms is that the current delivery system of the last 10 years ago is not sustainable. And our push has been towards a value-based delivery model, And there's several components of that that sort of all lead to each other. And the push, as you try to inflect the challenges in the healthcare delivery model, is that we have to slow the progression of our chronic diseases. And that allows us to begin to bend the cost curve, which is the real gorilla in the room. That allows us the opportunity to begin to promote health and wellness instead of being just a acuity-based care system where we're treating illness. In order to do that, one thing leading to the other, we have to leverage virtual care networks. We can't be with all people at all times, and we need to actually connect with our patients and engage them in different ways, giving us more capacity or preserved capacity, as I think of it, for the truly acutely ill. And then at the end of the rainbow, we have to reward quality because that's what we're motivating our providers around. In the center of all this, we have placed the physician as the coordinator or the ringleader of this evolving healthcare delivery model. And lo and behold, 5 years ago, CMS recognized that and put in mechanisms to reward providers for being the responsible party to help coordinate and manage care in this sort of cyclical model that we've put before you today. And I think at ChartSpan, that has allowed us to focus in deeply on services and programs that support that provider, primary care or specialty provider, as they attempt to help better manage and coordinate care for their patients.
And I think that's important because so often in value-based delivery, we think about flattening that cost curve at the point in which the patient has their highest acuity. And we come at it in a very different way, and we focus on those patients that have rising concerns with their health before they become a high utilizer in the system. And that's certainly our focus as we bundle our value-based care offering.
Mm-hmm. Mm-hmm. Absolutely. I know we'll spend our time today on the left-hand side on that first box around chronic care management. Important as anyone who knows us knows that that is one of the pillars of the company, of our programs that we offer. Annual wellness visits, a very big component of a preventative and health maintenance model in our transition to value-based care, and the services and impact and support that we provide to quality leaders, I think, worthy of its own conversation, obviously. But today we want to spend some time on chronic care management in this arena of COVID-19 preparedness and response, and talk about how we want folks to think about our value in this environment.
Sure. And so our origins started in 2013, selected by the Mayo Clinic as one of the top 10 healthcare startups in America, and proud 5 years later to be the largest provider of care coordination managed services in the country. We're proud to be in Greenville, South Carolina, equity backed with some of the biggest names in venture capital, 100,000 square foot headquarters in downtown Greenville, where we service more than 100 health systems and practices around the country. We're in strange times, Annie. It's not business as usual, is it?
No, business as usual is probably a long way away for us, for all of us at this point. And as we collectively lifted our heads as this pandemic and epidemic grew and touched our borders and began to impact our clients in our cities, what we saw and heard largely from our clients is there's a couple of things happening. We read about it, we see it on the news, but we also hear it directly from our clients and our partners, that the most vulnerable patients in our healthcare system are now asked to stay at home. And they're staying at home because they're at risk. And what that does is it puts them at a further distance from the providers that need to manage their care. Another dynamic, probably an offshoot of the first, is that calls into our physician practices are on the rise. And it's a little bit of an overwhelming burden, maybe not a little bit, a lot of an overwhelming burden to manage the inbound calls for advice, guidance, and symptom relief or symptom diagnosis virtually over a telephone. And I think while our patients always come first, the quality of care and the impact that we have on their lives is the most pressing thing we and our clients think about all the time. What's really getting some steam behind it is the fact that our waiting rooms are empty. Our usual E&M visits have vanished. And what that means at the end of the day is that the bottom line for our clients, our physician practitioners who need to be at the center of that care model, are having a really devastating time.
Today's discussion is really focused on RHCs and FQHCs, and we know they're getting hit really hard with the diminished E&M encounters. We were excited to see last week that Health and Human Services has awarded $100 million in HRSA awards to FQHCs and RHCs around the country, about 1,400. We know that the average award size is about 70,000 per practice, some as low as 30,000, some as high as 300, but 70,000 on average. If you want to find out if your FQHC or RHC qualifies, simply go to hrsa.gov and you can see this interactive map, click on it, and you'll know if your FQHC or RHC is included in the awards, and you'll find out exactly how much you have been awarded. Of course, there are questions about what can we use the award money for, and it really is distilled down into three areas: prevention, preparation, and response to the COVID-19 pandemic. And it's a pretty wide swath of applications that you can use the money for. But one of the things that we've taken note of is that it can be used to utilize CCM programs to assist in managing COVID-19 concerns. This means the associated costs with standing up a program, which sometimes can be pretty hefty, around data fees or your service fees. These awards can be used to pay those amounts. So this really fast tracks for an RHC or FQHC the opportunity to stand up a CCM program. Annie, we have so many FQHCs and RHCs who have programs today, and they are so thankful that they have those programs in place now.
Absolutely, absolutely. It is an unprecedented time, and anything that is available to these organizations to put service models in place and virtual care tactics on the playing field is super important.
There's new data that we just got in internally around CCM programs for our RHCs and FQHCs, and I wanted to share that data today. I know there's a lot on the screen here, but it speaks to some of the dramatic increases we've seen over the last few weeks in patient engagement. I'm talking about patients who are enrolled in a chronic care management program. One of the most significant we've seen is a 30% or nearly 30% increase in enrollments. More patients want to be in a chronic care management program as they are fearful, frankly, traveling outside their homes, and many can't. We become the first line of defense. So many doctors right now and providers are in triage mode. They're dealing with sick, patients. And so they're thankful to have us in place to manage the front lines for those highest at-risk patients. Two pieces of data that I think are really compelling. 3 out of 4 phone calls that we get right now, we're tackling COVID-19 subject matter with those patients. It may be us running through our clinical protocols to see if the patient in fact needs medical attention. It may be to explain to patients that there are scammers out there trying to get their Medicare ID information by claiming to have at-home tests that can be sent to them, which certainly is not true. To frankly, a lot of dialogue just around the fear that these patients have, Annie, and I know that's something you hear from our clients, just behaviorally addressing the fears that elderly have because they are at such high risk.
Sure. Some of the things that I think you'll probably call out is how do I arrange for transportation? How can I ensure that I have safe transportation? How do I know if what I have is a symptom of an allergy or if I have an emerging coronavirus afoot? Where would I get care if I needed care? Because my physician's office is, their outgoing message says that we shouldn't go there if it's not an acute illness. And I certainly don't want to find myself in an emergency room. So we have standard protocols that we're helping to walk our patients through. And I think that lifts up the burden off of our provider practices who are either dealing with an onslaught of calls, caring for acutely ill patients, or in preparedness mode with their local hospital, pondering the question of who will actually respond to a call from the ED when providers are no longer available that typically staff those areas, or the ICUs, or just serving as hospitalists.
And those protocols lead to this data that I thought was really interesting. Of everybody that we tackle COVID-19 subject matter with and end up screening, 98.1% don't need an appointment. So what we're doing is not clogging up those practices that frankly it's unsafe to have those patients there and probably don't want those patients there. And for the less than 2% the patients that need those appointments, we're able to direct and marshal those patients appropriately to the appropriate place. And I think it's been a huge benefit for our practices and for our providers for us to be able to follow the screening protocols for COVID-19 and keep their waiting rooms free of unnecessary patients and appointments. We want to remind everybody that ChartSpan has launched a COVID-19 Rapid Response CCM program. Annie, this was a lot of you and your team's idea about how we could remove the obstacles, because often there are many obstacles to getting a program stood up. Could you just briefly walk through this and why we're making a commitment to FQHCs and RHCs to stand up a program in 24 hours?
Absolutely, because the time is now, and never a more important time for all the reasons that we've just talked about. Our commitment to the industry and to these specialty type providers in particular is, as you said, take the barriers out of the way. No consideration around what your term of your agreement would be with us. Let's get the program up and deal with those technicalities and practicalities later. So a month-to-month agreement available. As soon as we can get patient level data from your EHR or practice management system to identify eligible patients, our implementation team is the best there is. And we'll have the program standing and ready to operate and begin enrolling patients in 24 hours. In addition, our delivery team, our client success leaders have pivoted what is typically a day on site in your practice, helping to educate and enfranchise your larger delivery team, all of those clinician and non-clinician providers, and how to be effective in launching the program. We're doing all that virtually. So that entire team has pivoted and remodeled the way that they work with you so that they can do so without having to be physically present, and they'll put all of our tools online for you as well.
It's so important. We know how patients benefit from the program. We're seeing huge increases in patient engagement because of the program. But let's be very candid. At a moment where you're getting pinched on cash flow, a CCM program provides a predictable cash flow for practices that truly need it right now. We want to encourage anybody that wants to know more information to reach out to their regional vice president or send us an email at info@chartspan.com. Annie, thanks for joining us today.
It's been my pleasure. Thank you.